Welcome and thank you for attending Reducing Toxic Burden and Healing the Gut with Precision Diet, Supplements, and Lifestyle Recommendations. My name is Adair Anderson. I'm a clinical lab educator here at Vibrant Wellness and will be your moderator this evening. I will be responding to live chat and Q&A throughout the presentation, and following the presentation, there will be approximately 15 minutes for live Q&A. As a reminder, all attendees are in listen-only mode, so please submit your questions through the virtual Q&A or chat applications. The content of this webinar is for educational and informational purposes only. The information is not intended to treat, cure, or prevent any condition or disease. If you desire medical advice, diagnosis, or treatment, please consult with a medical professional or healthcare provider. And now let me introduce to you today's presenter, Greer McGuinness, who is a clinical lab educator here at Vibrant. Greer McGuinness is a registered dietitian, certified detox specialist, and certified Lyme practitioner. Greer obtained her master's in nutritional science from Central Michigan University. She is a published researcher, speaker, and consultant. Greer consults in herbal medicine, food sensitivities, gut health, and detoxing heavy metals and toxins. She specializes in pediatrics with a focus on functional medicine with autism and ADHD. A New York native, Greer enjoys spending time with her family, researching, baking, and enjoying the outdoors. Without further ado, I'll turn it over to Greer.
Thank you, Adair. Hi, everybody. I'm Greer, and welcome to Reducing Toxic Burden, Healing the Gut with Precision Diet, Supplements, Lifestyle Recommendations, and we are going to dive in. As always, please always take a look at our education portal in the Vibrant Lab section. We have a ton of CAP accreditations, CLIA certifications, and we are trying to be the forefront in functional medicine research and expand what we do. And so please, if you have some great information, send it our way. If you'd like to read what we have published, we always have those up on our portal. So please feel free to take a look. So this is the Series 2 Agenda Web Bootcamp. We are going to be reviewing some case studies. We're going to talk about some diet suggestions, supplement suggestions, lifestyle suggestions based on case studies, which I hope you guys will very much enjoy. We'll talk about some biomonitoring and surveillancing of outcomes of total toxic burden. And we have some really amazing free gifts for you guys today. We have a detox health food plan, a mycotoxin specific binder sheet, and detox support nutraceutical guide. So I cannot wait to show you guys those. We've been working really hard on getting those ready for you guys. So I think you'll really enjoy that. So just keep in mind that when we are working with patients, when we are trying to work with detoxing and removing of toxins and working on the body, we want to stand, okay? We want to support our patients. We want to make sure we get a really good history. And if you remember in the first webinar, we had some great handouts and some questionnaires that could be used. And we want to make sure that we understand what our patients needs and what is going on in their system. Testing. We need to identify what we're trying to work on with our patients. I have a lot of patients and providers that come to me and say, I need to detox. How do you detox? What are we detoxing? Not all supplements and binders are created equal. So we really need to make sure we understand exactly what we're trying to remove from the system before actually putting into place some nutritional supplementation or herbs. Avoidance is the biggest key. Whether it's mycotoxin exposure, heavy metals in water, the first thing is always going to be avoidance. So that needs to be coming from the test results. So what are they positive for, and what are we needing to avoid? Nutrition, we want to make sure we're improving their diversity, making sure that they're pulling out all the food sensitivities and they're getting what they need nutritionally to fuel their body. And then detoxing. Should be always the last step. I never really start detoxing somebody until I have the system set up. And using supplements and herbs are definitely a really amazing way to help rebalance the system and get toxins out of the system. But we really need to make sure that this is sometimes the last step that we do. Because if the body's not ready and primed, I'll show you guys in a few slides what could potentially happen. Now, when we look at people and we're trying to figure out a way to detox them, always keep in mind the exposome concept, okay? And this is, for me, very important because I work in pediatrics. And for me, when I'm working with babies or, like children from, newborns to 16, I also have to take into consideration mom. And I also need to take into consideration what they're being exposed to too. There are so many things that play a role into this aspect when somebody is older and unfortunately they get cancer, they have Parkinson's disease and things like that. What could have been those exposomes that they have been coming in contact with over time that could be leading to this particular issue? So it's really important that we need to kind of look at this as a whole and say, okay, what is going on? What have they been accumulating with over time? And how can we support their system, whether it be avoidance for sure? Is there a genetic component here? Or do we have to take a look at their lifestyle changes and make a change so that as they grow and as they get older, this particular toxin isn't a problem for them anymore? Now, I love this downregulation of detoxing toxins because this is what's really, really important to understand. When we get toxins into our system and we are worried about them finding a home, sometimes they'll give up a condo and they'll go find a house. So if they're trying to find a place to go store, they're sometimes going to go into our body, in our brain, in our adipose tissue, in our bones, in our fat cells, brain. So if these toxins are going into these particular areas, and then we're trying to detox them, we're pulling them out of these spaces that we don't want them in. And then we're trying to excrete them. We detox through urine, feces, and sweat. So if we're trying to detox them, we're trying to excrete them out of the system. If we're not careful, if we're not doing this the correct way, you will get recirculation of toxins. They will then find a new home and a new place to disrupt. So it's very important to understand. This is why I really leave detox to the last part before I set up the system. Fix the gut, fix those micronutrients. And we talked about that in the previous seminar, that we need to work on healing leaky gut. We need to work on that bile flow. All those things are so important when we're trying to pull toxins out of the system and get them out of the body completely and not have them recirculate. So you can see all my red arrows, things can kind of go back and forth. And that's unfortunately some of the trouble when you're trying to detox. So when people put patients on general detox, that could actually be a little bit scary because those general detoxes might not be actually attacking what we really want and need it to. So again, all binders and all detoxing herbs and products are not equivalent to every single toxin. So we do need to know what toxin we're dealing with. So with the leaky gut aspect, this is one of the hardest things that, trying to get people to fully understand that anytime we're dealing with toxins, they can go into our bloodstream. If we have a healthy gut lining, that's helping us to prevent toxins from being in the system. So if you have a patient that you've done a stool test and maybe they have leaky gut, we need to work on that first. We need to start repairing that gut because of two different things can occur. We can have toxins go through a paracellular transport pathway, which essentially means referring to the substances crossing the epithelium by passing through the intercellular space between the cells. So right through that gap in that opening. We can also have transcellular pathway transport, which means that they're passing through the cell and through the apical membrane and basolateral membrane. So they're basically going straight through the passage. So we're going right into the bloodstream, and then that's where they go and find those homes, the brain, the tissues, bones, our reproductive organs. This is where we don't want them to. So it's very important. The leaky gut aspect needs to be handled at the same time that we're trying to repair the microbiome. So there's 4 basic concepts and components to detoxing. So we can use different modalities in this area to help us with the detox process. It's not just putting a patient on binders. I know that sounds very enticing and very easy, but it really is a lot more complicated than that. So you can see when we're looking at the system as a whole, one of the biggest issues that many of our patients face is that things like inflammation. They have very low antioxidants, which is why they're so toxic in the first place. They have oxidative stress and they're just accumulating those toxins. And then we can use binders and detox support when we're actually trying to take them out of the system. So I have examples up here of different types of supplements and herbs that you can utilize in your practice, but you have to make sure that when we're using these 4 basic components for detoxing, that we have to know what we're up against. We need to see what is going on in your patient, and that's where the testing comes in. So I'm super excited to show you guys some of the case studies and how you would apply these 4 basic components for detoxing into your practice. And here are some of the giveaways, which I'm very excited about. We have a nutraceutical guide, and that is going to help you with figuring out maybe what different types of supplement companies have great products and which ones might be best for your patients. And it kind of gives you a list of all the ingredients that are in them, which is super helpful for providers if you have to maybe make some changes. I know sometimes my kiddos have black walnut intolerance, so I have to find something else to utilize with that. So definitely take a look at that. We also have the mycotoxin specific binder agent. This will help you identify what specific binder will help you with your patient and what mold to detox. Because again, not all binders are created equal. Binders will only kind of gravitate towards certain toxins depending on that toxin. And lastly, we have the detoxification food plan, which would be awesome for your patients. It's so easy for providers. You print this out, you put in what you want your patient to consume from each food group. You can circle things, cross it off, and it helps your patients start figuring out what better foods and what food plans are going to work best for them. It's an awesome handout. I think you guys will really enjoy it. I already do. Parents love it. And I think it's a great tool to have in any office. So let's dive into our first case study, which is an adult female. So this is a 42-year-old female. She was struggling with weight gain. She had gained about 25, 30 pounds in a year. She has 2 small children, and she thinks she possibly has PCOS and having some issues with her menstrual cycle. She does complain of poor sleep, constant fatigue, irritability, some anxiety, and some acne that kind of comes and goes. So, they didn't run all the tests, but they did run a series of testing. And it was actually kind of interesting to see this whole big clinical picture together, because once we start looking at the clinical picture with symptoms, it kind of starts to make sense. So they did do a thyroid panel, and the first thing I noticed is her free T4 and her TSH was her free T4 was low, her TSH was a little high, which could indicate an underactive thyroid or hypothyroidism. They weren't she wasn't complaining of any other types of symptoms other than feeling like, didn't really think it was Hashimoto's, but she had an inkling that she might have Hashimoto's because somebody else who she's friends with had it. So that's why she wanted to run this panel. So we have the anti-TPO and the anti-TG that was elevated, the thyroid peroxidase antibody and the thyroglobulin antibodies. This can be a sign of Hashimoto's when they're both elevated. And this autoimmune disease can also be very common with hypothyroidism. So it was definitely something that was eye-opening, where this could be a potential reason why she has had weight gain for the past year. But why? Why was all of a sudden her thyroid kind of going a little bit out of whack? Heavy metals. So taking a look at her heavy metal toxicity kind of was a little bit eye-opening for her too. And for kind of looking at the labs going, okay, you might have hypothyroidism, you might have Hashimoto's, but what could be the driving force to that? Well, a couple things. Lead. So I know she didn't trigger in red for lead, but her lead level excretion was a little bit high. And when I noticed that the lead level kind of starts going up, no more towards that control range or high risk, I get a little concerned because lead should be really at like 0. Okay. Heavy metals should not be in our system. So when I start seeing lead, I'm like, what's going on? So lead does impair the pituitary thyroid axis and can provide alterations of TSH levels. So that's one key factor that I started looking into. The other one was mercury. So there are studies that show that as people age, the presence of mercury in the follicular cells in the thyroid actually increased. Pretty much about 1/3 of people over 60 had significantly elevated levels of mercury. So mercury also plays a role in the pathogenesis of thyroid cancer, autoimmune thyroiditis, and hypothyroidism as well. So that could definitely be a big trigger for her. And then she also had tellurium, which for me, I know causes typically oxidative stress. It tanks our glutathione, it depletes our energy, decreases our ATP synthesis. So for her, I'm looking at this going, okay, I think this is more to the story. This could be a driving force of why your thyroid levels could be up and why you could almost have like a Hashimoto's possible diagnosis, but maybe it's not real Hashimoto's. And then we did mycotoxins. She did environmental toxins too. Mycotoxins lit up like a Christmas tree. Now, when providers consult with us, they're always like, well, which one's which? What should I be doing? Well, we have an amazing handout for you guys. This handout is really a great tool to have and I've already circled what she was elevated in. So you can see the ones that she is actually high in versus the environmental versus food. So a lot of food related mycotoxins can still definitely be a problem. It could definitely still cause low glutathione levels, low immune system suppression, can definitely impact our liver and our kidneys. But sometimes when people are thinking about that black mold or the most toxic mold, that's where we're sometimes a little bit more concerned with our patients, but realize when somebody still is excreting a ton of mold, this could definitely be an issue on their immune system response and just depleting them constantly and damaging the microbiome. Now, her provider did do urinary hormones, and this was really interesting because it kind of made a lot of sense with a lot of her symptoms. So she had the 4-MeO on top, which actually can mean when that level is low, it actually can mean low pore methylation in the phase 2 pathways. Detoxification. So we are not detoxing at all, which obviously I could expect from this. She had her total cortisol and cortisone levels, both free and total, elevated. She doesn't feel good. She's under stress. So we definitely know she has high elevated of stress. She's not sleeping. And so that could definitely be a big problem. The one marker that I love to kind of show providers is this 8-OHDG. Okay. This one is predominantly showing the forms of free radical induced oxidative stress. Okay. This is a really great biomarker that also shows risks of possible various cancers and degenerative disease. It's been linked to things like volatile compounds in our air, lifestyle choices, smoking, medication. So this is, again, just further information showing that her body is not performing, it's not detoxing, it's under stress, and this could be a definite why she possibly has elevated thyroid levels and heavy metals and mycotoxins and environmental toxins. So we definitely can see she's got several endocrine disruptors. Now, endocrine disruptor chemicals are substances that are found anywhere. And for women, we use probably 8 more products than men between makeup, shampoos, conditioners, deodorant, lotion. We use a whole lot more than an adult male. So when we're taking these endocrine disruptor chemicals actually act like hormone mimics, and it tricks our body into thinking that they are hormones, and they're not. They can even block natural hormones from doing their job. They can increase levels of hormones. They can impact anything that we're trying to make or break down or store. It can impact so many different components. So for her, this could be a definite issue of why she has oxidative stress and she's gaining weight too, and her hormones kind of feel like they're out of whack as well. So we definitely love to start detoxing detoxing, pulling those things out and avoiding those at all costs. One of the second to last tests she did was also inflammation panel. And this one was, again, just further confirming she does have issues. Her homocysteine and her CRP was elevated. She's having issues with methylation, possibly MTHFR comp mutation. And then she also had this MPO, which is myeloperoxidase, which is white blood cell derived inflammatory enzymes. This actually measures disease activity in the luminal aspect of the arterial wall. So when the arterial wall is damaged or inflamed, MPO is released by invading macrophages where it accumulates. And then all of a sudden we have this mount up effect of more inflammation, more inflammation, more inflammation. So whenever I see this, it's 100% oxidative stress. So this poor woman was under so much pressure and so much stress. She also did a food sensitivity test, which I think was really helpful. She actually did the IgA, IgG, IgG4, and C3D. So IgA is intestinal mucosa. So when you eat a food and it agitates your gut lining, that's IgA. IgG is systemic. So when you eat a food and it goes into the white blood cell, then that could be a problem. Into the bloodstream, then that creates an issue. And then you have IgG4 and C3D, which are parts of innate and adaptive responses to the immune system. It kind of gives us another layer to see what our body's really creating that inflammatory response to. So my favorite part, let's talk about some interventions for her. Okay. So we removed food sensitivities. Obviously we removed some of her top inflammatory foods. We did remove gluten, and I did suggest removing gluten with the provider because also the molecular structure of gliadin, which is the protein in gluten, very closely resembles the thyroid gland. So when gliadin breaches the protective barrier of the gut and it goes in and it enters the bloodstream, the immune system goes and targets that. But because it looks so much like the thyroid, it's going to attack gliadin and it's going to attack the thyroid. So that's why you get that Hashimoto's autoimmune response going on. So we also did talk about thyroid support. So we just talked about basic things. Now, I'm a very firm believer of not putting everyone on 80,000 supplements. So we just talked about using things like selenium and iodine, adding some Brazil nuts, seaweed, flaxseed, just to give her thyroid like a little bit added support. But I didn't think she needed a ton because we definitely wanted to work on some other aspects. So we definitely kind of did work on the gut a little bit. Now, we didn't really have a stool test, but the provider did put her on probiotic, and I did suggest bile support. And the reason for bile support, again, is anytime we're detoxing toxins, they're going out through our bile. And we need to make sure our bile is thin, it's movable, and it's taking everything out of our system and not getting all gunked up. I love TUDCA. TUDCA is a hydrophilic bile, which is taurine conjugated from uroeclic acid. Say that 5 times fast. And that could be really helpful. I've seen TUDCA work really amazing for even kiddos. Talked about maybe HCl-betaine, some digestive enzymes, and I think that would really be supportive and helpful. We talked about that oxidative stress. She has tons of oxidative stress. So let's push up those antioxidants, vitamin A, C, D, E. Her minerals, biotin, melatonin is not only neuroprotective, but it can really help with our immune response too and our oxidative stress. Sulforaphane, I absolutely love. CoQ10, anything that really supports and drives down that oxidative stress for her. The biggest thing though, I think, not only with the oxidative stress, would be lowering that cortisol. So like things like ashwagandha can lower not only cortisol, but also DHEA. And that could be really helpful when we're trying to calm down the system. And things like, lemon balm and chamomile, are some of my favorite. They're great adaptogens that we classify them as like analgesics in herbal medicine, where if someone's having like a panic attack, you could give them lemon balm and it will work pretty rapidly within like 30 minutes to kind of calm down the system. So, and it's safe for children too. I love lemon balm and chamomile. Like you could do chamomile tea at night. And that really is a nice, calming, soothing, protective to the system as well. We did do some antifungals, and we talked about some antifungals, which I love. You could do tinctures, you could, do individual, because you still have to kill mold. So just binding, I don't usually just bind mold, I kill the mold. We have to kill it. It's a fungi, and it's usually hiding somewhere. It's not just always free floating. So I love going after it with some really good antifungals, binders. And like I said, we're going to send you that binder handout, which is going to make your life 10 times easier. So for her binders that she needs, you could do things like fulvic and humic acid. You could do modified citrus pectin, activated charcoal, different types of clays. Those are all great for the types of mold that she has. And then additional supplements, definitely support that methylation cycle: vitamin D, betaine, magnesium, B complexes. Lauric acid is amazing. Not only is it great antifungal, but immune system support. You could do, and she definitely probably needs some meditation exercises, and ozone therapy could definitely be an added supporting system to decrease that inflammation and get more oxygen into the system. And we definitely recommended the NutriPro. We definitely wanted to kind of look at that methylation cycle and panel with her. And we definitely wanted to look at a stool test, but that was basically an interesting case that I thought actually put all the pieces together, and she's doing really well now. And her thyroid levels are back to normal, which is fabulous. All right. So next is my favorite, which is a pediatric male patient. This is one of my patients. He was a 4-year-old little boy, has autism diagnosis at age 2. He has difficulty focusing, hyperactivity, poor coordination and balance. So what we say, like low muscle tone, mood instability, does have some hives and skin rashes that come and go with the season changes. Bowel movements consistently loose, not formed, is a good eater, eats a variety of food, and wasn't limited. That's a new one. That usually doesn't ever happen. So when we did a bunch of different tests, we did a wheat zoomer. The family wanted, a big thing in the autism ADHD community is, should my child be gluten-free? Should my child be dairy-free? Well, I say test, don't guess. So we tested, and we wanted to kind of rule this out. We could see the intestinal permeability and toxic load. We could definitely see that he had some issues. And I kind of suspected that pretty much all of my patients will have some type of issue in that particular area. When I see amylase and protease peptide, this actually means that our digestive system is actually not breaking down the peptides in wheat. So for me, that's a huge indicator that there is a need for digestive support. So that could be a potential reason why he has loose stools, and he's excreting a lot of probably fat in his stool, and he's not actually having formed stool. So when I see that, I usually will automatically put them on like some type of digestive support enzyme. Now, if you have a patient that is having brain fog, poor coordination, almost like ADHD-like symptoms, you may really see your gluteomorphin and proteonorphin elevated in the wheat zoomer. And this is the morphine-like opioid receptors going off, and it actually makes people crave and want to eat things like wheat or gluten. So they are craving the things that make them the worst, which is what our body unfortunately does. So sometimes, especially depending on the level, if your kids or whoever you're testing is really high, if you do take them off of gluten, I will kind of forewarn you, they will crash. They will have a really hard detox from this, because it's essentially detoxing from a drug. So the higher the number, the harder the crash. So sometimes I do like a 70-30 and I start removing at least 70% and then leave that 30% and then slowly take them off that 30%, because it just makes life a little bit easier, not only for mom, but also for the child. So always keep that in mind. Whenever you see that gluteomorphin, proteonorphin, think ADHD, okay? Because that's basically what even adult patients will feel exactly the same as a child. We did normal food sensitivity, and you can see on the top left, they did actually trigger for black walnut. So there are certain tinctures that I couldn't use with this child. We did do a gut zoomer. I didn't put it on here, but there wasn't anything too significant. There was a little leaky gut, but nothing that was too crazy. There was no parasites or real like tons of overgrowth. So, but one of the things that we did find out was he did have some heavy metals. And these are things for me that are huge triggers, because especially for kiddos, they, their bodies are so small that these toxins and these heavy metals love to go to different areas, especially the brain. So the barium that he had actually was from a CT scan that he had at age 2, because he was having gut issues. Now what's interesting is barium comes from barite, which is a naturally occurring element, because it's heavy metals are naturally occurring. And the FDA and everybody claims that using barium, when you do a barium swallow or barium CT scans are safe. As long as the person's a healthy individual. Well, how many healthy individuals are going for CT scans needing contrast? Not many. What we do know about barium, especially with kids, is barium can actually elevate glutamate levels, and they can activate catecholamines. So when you elevate glutamate levels, those are your excitatory receptors. So you could get a kid bouncing off the walls, hyperactive. And when you're activating catecholamines, that's dopamine. That could be your muscle twitches, nervous system effects like tics. So always think that sometimes these heavy metals and these types of toxins that are in our system that are being excreted, it's a great thing that they're being excreted, but that means that there's more of it in our system, and we're trying to figure out where it's coming from. The supposed rate of excretion for any type of barium that you're taking in from a contrast is about 30 to 60 days. This is 2 years, and the kid still has it in his system. Nickel was really high. Now, nickel is a very common heavy metal, and you probably use it every day and you don't even realize it. Between jewelry, your car keys, your forks, knives, and spoons, a lot of the times have nickel in them. And if kids are touching them and holding them or playing with them, electronics have nickel in them too. That could definitely be a problem. So 2 things with nickel that if you're not aware, it actually can increase the pathogenicity of H. pylori. So if your patient, you think your patient might have H. pylori or like a SIBO, it actually improves 2 enzymes, hydrogenase and urease of H. pylori. So it can actually give it fuel to thrive. And then also nickel can cause IBS. So again, he was having loose stools. So this could definitely be a potential issue. And then tellurium's in everything again. I see a lot of my kiddos with tellurium, and I think a lot of it's because tellurium is an alloy that gets added to other types of heavy metals, aluminum, gold, silver, and because it's an alloy, it makes it tougher and harder and thicker. So it's used in so many different things, including electronics. But this one, there's not a ton of research on it, except for the fact of what I found of how it definitely lowers our antioxidants, lowers our glutathione, damages our ATP, and we can't produce energy. So again, with kids with autism, I'm thinking anything with energy, anything with brain function. So when we ran his environmental toxins panel, I'm always I bet all my kiddos have some type of toxins in them. It's just almost inevitable at this point. It's always, what toxins am I dealing with? Not, what do they have toxins? When you're working with kids, remember, they breathe in 2 times more air than adults, and they consume 3 to 4 times more food than an adult. So they're going to consume a ton more pesticides, a ton more glyphosate, plastics, etc. But when I see the tegoglycine marker, this is mitochondrial dysfunction marker. Okay. So if it's extremely high, significantly high, it could be a genetic issue, but when it's moderately or slightly elevated, this could definitely be a mitochondrial issue. And this could be induced from toxins, from infections, from inflammation, nutrition deficiencies. So I know now that this kid has some type of mitochondrial issue going on too. So he's having issues producing ATP energy, and his brain is not functioning properly. So for me, that's a problem. He didn't have a ton of mycotoxins. He had some basic food mycotoxins, which again would be pretty normal, grains, oats, barley, peanuts, fruits. So nothing that was too crazy that I, thought, making sure we're always just ruling out potential black molds. I actually just talked to a patient the other day. the child has mold, and it was from the mom who had moldy breast implants. So that's been going around in the news lately. She passed it on to her daughter in utero, and her daughter had mold since birth and was having issues since birth. They only just diagnosed it not too long ago. So keep that in mind, that a lot of these mycotoxins and environmental toxins, heavy metals, can be passed on through utero as well. So what did we do? Okay, so we removed the food sensitivities, we removed gluten, we tried to remove anything that could potentially be a mold issue, which really wasn't that many things. Gluten, probably corn, soy, things like that. We definitely worked on the microbiome a bit. I love working with different types of like kids' chewable digestive enzymes. You can really find a really great chewable digestive enzyme for kiddos that they can chew, or you can grind it up and give it to them. So it's super easy. You can work on adding teas. Now, understand adults are not mini, or kids are not mini adults. Okay. So you have to kind of take a look at them and take what you do to an adult and modify it almost completely half the time. I don't like just throwing supplements at kiddos all the time. So I try to really work with the parents to do changes like milk thistle tea, dandelion root tea. You can dilute this tea, you can steep it, dilute it, add just a few drops. And it's super helpful just to start adding that. You can use monk fruit and honey to kind of sweeten it, stevia even. And it's super easy for them to start liking other things besides juice, and teas are a great way to add that in. Micronutrients. Now, he's only 4, so the brain is still growing. By the time a kid is around 5 or going into kindergarten, 90% of the brain is fully developed. They need high amounts of fat. More than 50% of their daily intake needs to be fat. So this is critical. So we started putting them on multivitamins, mineral supplements, fish oils. We started with avocado, polyphenols, things like that, and really kind of boosted them up. We also did a mitochondrial cocktail. Now they do make, you can do this separate, or they do make, mitochondrial cocktail supplements, which are really helpful, where you can just open up a capsule. They do make children's mitochondrial cocktail supplements that have things to support the mitochondrial part of the brain. And this is typically what they have in them. So for the heavy metals, we'd use zeolites to detox. Barium is a really tough one to detox. Not many things actually detox barium. So besides that, I also used NRF2, and you'll see that in the environmental section too, because that could be used for both. We did work on the environmental toxins. We worked on glutathione, the B complexes, folate. I love liposomal glutathione. They make some really yummy liquid ones for kiddos, which is really, really great. You can also use things like broccoli sprouts and stuff, which is sulforaphane. Anything to promote that detoxification to support the liver is what it's all about for kiddos. So if you think about kiddos, their liver is not fully formed until they're about 21, which is why our drinking age is 21. So we need to support the liver as much as we can and get their nutrients up, because if they have a nutrient deficiency, their liver is not going to work. Now, drainage pathways. Drainage pathways, you cannot put a kid in a sauna, so let's get creative. Trampolines, amazing. Get them an indoor, outdoor trampoline, get that lymphatic massages. You could do dry brushing, which is really helpful. Vibrating plates are huge, and they'll love that, especially if they're sensory seekers, and chiropractors. Anything to really support the drainage pathways to get those toxins and move them out of the system. Epsom salt baths, things like that are so helpful. And I think that would be a great addition. And you can do that for adults too, especially if your adult patients don't want to go to the gym, they don't want to go for walks, they don't want to do anything. Trampoline, vibrating plate, chiropractor. Very simple. All right. And last one, my adult male patient. So this one was a really funny one because I loved the way that they explained their symptoms. This is a 63-year-old male patient. He presented with moldy symptoms. He said he felt moldy and he felt candida-ish. which I thought was really interesting because he was describing how he was feeling by some of his symptoms. And, you know, when your patients are trying to explain how they're feeling, they might hit the nail on the head and just no one else is paying attention and listening to them. So when he was like, well, I kind of feel moldy-ish and like, I feel candida-ish. Like, I feel like when I take certain things, like I feel like the candida goes away. I'm like, okay, well, let's explore that. We did have some gas, bloating, constipation, diarrhea, some low energy, fatigue and brain fog, back pain. So back pain was a big trigger to me about mold too. And he had been on and off binders for a couple of years and said that when he's on binders, he feels great. When he's off binders, he doesn't feel great. Okay. So that was kind of some big ticks for me. So his heavy metal test was actually pretty interesting because when I see this, I can kind of automatically tell the person probably has a well. Whenever I see uranium, it's typically an indicator to me that the person has well water. And that's where they're drinking from. They have always been told, and a lot of people who get their well water serviced by people, one provider had told me that they had somebody come out to test their well water and they said, oh, you'd have to drink the well water for like 300 years or something silly like that in order to have uranium built up in the system. And then when she took her test, she had high uranium. So not always, but a lot of times I asked if he had a well, he said yes. This definitely affects kidneys and bones. It has like an affinity to that. It can definitely cause damage and definitely cause autoimmune disease and cancers and things like that. And same with arsenic. So arsenic things like can damage our DNA. It could damage our skin. It could damage like the immune response as well. So we definitely I take heavy metals pretty seriously. But again, I can't always work on these until I work on the rest of the system and see what else we're up against. Environmental toxins was not terrible. He did have some, you know, insecticides, some paints and lacquers and gasoline and some plastics. Nothing crazy, nothing that was outpouring to me like, oh my gosh, you know, he's full of these environmental toxins, until we got to mycotoxins. And he was 100% right. He not only he felt moldy-ish, but he also had gut issues related to this as well. And these are, you know, things that mycotoxins can not only affect us, but they can affect our pets. And his dog was actually sick. So it was actually kind of interesting that some of the things that he was consuming, you know, was things that he was giving to his dog, and that could be why his dog was sick. So it's pretty interesting. Don't feed your dog table scraps if you feel like you're eating moldy stuff. So one of the things that when I look at this, if I see something like gliotoxin, this is going to be a huge red flag and trigger to me that hopefully the person did a stool test. If they didn't, he did not, we're going to encourage a stool test and maybe some fungal antibody tests, because gliotoxin comes from Aspergillus and especially Candida albicans. So gliotoxin is immunosuppressive. It can cause things like apoptosis, which is cell death in the brain. It can cause a lot of different types of auto issues with our things like our neutrophils, our eosinophils, macrophages, and things like that. It actually increases our risks for more infections and disease when we have this in our system. So this is kind of one of those things that we definitely want to take seriously and try to get rid of as much as we possibly can. But this really is possibly a gut issue plus a mycotoxin issue. He also had mycophenolic acid. Now, mycophenolic acid is actually used as a medication to suppress the immune system when somebody has an organ transplant, or if someone's dealing with something like Crohn's or lupus, they're actually given mycophenolic acid in a capsule to lower, so they don't reject the organs and they don't have these immune system flare-ups. So when we have these things and we're seeing just constant immune tax and the immune system is dropping down, we need to take this and go, okay, what else could we be doing? And what else obviously is going on in his system? And how can we support his gut? How can we support his body so that this doesn't continue to be a problem? He also had Stachybotrys, black mold. He was living in a moldy environment, in a moldy home. He had water damage. He didn't clean it up correctly. It was all over. And one of the biggest things, and when he said back pain, that it never really probably went away, it could likely be from the Stachybotrys, our black or most toxic mold. These molds go right up into our nasal system. It can attack any part, like any symptom you can think about could be potentially a mold symptom. So for me, I think one of his biggest things was more of a mold issue than anything. And that was one of the things that we definitely tackled and worked on with him specifically. We recommended a gut zoomer, of course, and a micronutrient. We wanted to make sure that he was okay in those two areas. We did do a candida diet. That was really important. We also, when we're dealing with things like gliotoxin, because of the relationship with candida, you can basically kind of treat it like you would candida. So your NAC, your clay. But one of the big controversies, and I just want to make this known with providers, is the spore-based probiotics. Okay. It could be amazing for gliotoxin. It could be amazing for candida. It may have an issue with Stachybotrys. It's one of the few mycotoxins that does not have the research to support that spore-based probiotics binds and removes and helps with the removal of Stachybotrys. It's almost like a 50-50 shot. It could help. It could make things way worse. So there's a lot of discrepancy in the functional world on this topic. So I just want to bring that to your attention, because you could put somebody on a spore-based probiotic thinking you're helping them to remove their candida and gliotoxin. But if they have Stachybotrys, it could make it worse. So just keep that in mind. BioFlow, digestive support, enzymes, TUDCA, green tea. I love green tea, especially if you have a sensitive person. It is an antifungal, but it's a very gentle antifungal, but it also can help clear out the liver. Same with artichoke leaf. Love artichoke leaf. That's like some of my favorites. Antifungals and biofilm busters. So these could be used in so many different aspects where you can use them and take them on in your diet, where you can add these spices and herbs and eat them every day, make them in soup. You can take them orally. You can make inhalers. You can actually use essential oils like peppermint, especially if someone's living in a moldy environment. You can make an inhaler with essential oil of peppermint and they can smell it, and that helps break up the colonization of the mycotoxins in the nasal cavity. And so, yeah, I love all of those. You can use them in tinctures too. There are tons of tinctures too that are antifungals. So binders. So definitely, I said, if you're not going to move, you need to do an ERMI test possibly, or, use some Petri dishes around your house and let's see what's actually going on. And if you don't know what an ERMI test is, and this might be new to you, they take a sample of the dust in your home and they analyze it with very specific, looking for specific DNA-based methods for quantifying mold species. It's not 100% accurate, but it is super helpful at trying to detect if you do have mold in your home. We did put him on a couple different binders because he had so many different types of mold that I felt like he needed a bit more support than just what he was getting. So we did do clays, fulvic and humic acid. We did activated carbon, and we did do some dietary fibers, and soluble fiber is very helpful at getting mold out of the system. Heavy metals, we did zeolites, modified citrus pectin, which I love, chlorella and ALA, alpha lipoic acid, which really helps with glutathione repair. It really helps boost up those vitamin C and E. And then we definitely worked on the lymphatic drainage. So for him, he definitely needed a little bit more support in that area. You could tell he was a bit swollen from the way that the provider was explaining. He seemed puffy. He was holding on to some water. So I said, maybe really work on the lymphatic drainage aspect with him too, maybe even first to start clearing that out. So things like stinging nettle supports the lymphatic system, also supports the kidneys and the liver. Golden seal, calendula. Calendula is I love calendula. You can use this as teas. You can use this as an oil and rub it on your skin and do deep tissue massages. So you could take it as a capsule too. I love calendula. It's an amazing herb too. Making sure he's staying hydrated. Doing some breathing techniques, infrared saunas. He was able to do all those things, and he greatly improved within a few weeks. He started really improving really well, which is really great. So that is pretty much all of the case studies. I hope that was exciting for you. It was exciting for me. And I'm very excited because we're going to be hosting our Series 3 bootcamp on the 27th, and we are going to be going over our brand new report that's coming out. We have a brand new total tox panel coming out, and this is a sneak peek of what it's going to look like. I'm going to show you how to interpret this test now because it's new, the NHANES reference ranges that we've changed. We're also going to show you the new organic acids test that's coming out and how to interpret that as well. So I hope that is going to be something you're all very excited and looking forward to, because I'm really excited about looking forward to this test. It's amazing. So definitely join us next October 27th at 1 p.m. Eastern Standard Time. We are going to be doing the third and final boot camp for these series on toxins, and you can ask all the questions on the new test, and I hope you guys enjoy it.
Thank you, Greer, for such an informative, relevant, and meaningful presentation. We'll now begin the Q&A. It looks like someone missed something about when you were talking about Candida. They asked, how about HIV? I missed that part because I was answering questions, but maybe it makes sense to you.
Doesn't make sense. I'm not sure if they're asking if it's related, or I'm not sure.
Oh, someone wants to know what the spore-based probiotics are.
So spore-based probiotics are a different form of, it's not just going to be your lacto and bacillus, is your Saccharomyces boulardii and other type of probiotics. It's a different, I don't really know how to it's a different we have different types. We have lactobacillus, we have bifidus, and we have Saccharomyces boulardii actually as a microbial organism in our system. So sometimes it is a yeast based. So with the yeast, it could be helping to decrease the yeast in the system and rebalancing it. Allows the lactobacillus and the bifidus to rebalance basically on their own. And that's why the research for, if you're actually taking a look at the research now on things like spore-based probiotics, it's literally taking off. But it's not for everybody. I don't feel that everyone can tolerate it. I can't tolerate it at all, but I also have chattoglobulin mold, and that I think could be a reason why. So, but it has been helpful. And for people who deal with Candida and things like that, it's really a stellar product.
Thank you for that.
Yeah.
I'm like looking back between the Q&A and the webinar.
Yeah. So they love the essential oils, love the oils. I love oils. Oils are super helpful. Just not even you could take them topically, you could take them orally, you can use them as nasal sprays. I mean, they're the list is long and endless. And, if you think about all the tinctures and things that are out there, they're based on oils. So I didn't tolerate the spore-based probiotic. I have chattoglobulin mold from a moldy building. That one actually does not have a ton of research on it. I've looked high and low. I've researched for months on that one. And it's not a one size fits all, and they do need to do more research on that. So I think for maybe it could just be me. I have not really met too many people with the same mold as me. So for me, that was just why I couldn't, I think I could not tolerate it.
Someone else is asking, how would one be able to tell if they can't tolerate the spore-based probiotics? What symptoms would someone get if they took them and it just wasn't good for them?
You can honestly get almost like an allergic reaction, essentially. I got very itchy and very almost like I want to say like hivish, like I just felt kind of like in my own skin, kind of like didn't do well. I had a ton of GI discomfort, and it basically felt almost like a histamine response. I felt itchy, like my face got really red. So for me, I was just like, okay, maybe this is too strong. Maybe it's reacting to the mycotoxins in my gut. So that's why I said it's kind of sometimes with certain molds like the Stachybotrys, it's a very controversial thing. I've seen it work for some and work very bad for others. So that's the only one I'm usually very cautious with, especially if you have Stachybotrys.
Oh, we're getting the question about the total tox burden test, heavy metals, environmental toxins, mycotoxins. Are these provoked or not provoked?
These were all unprovoked. If I think the male was the last one was the only one that was provoked because he was on and off binders for a long time. So anytime you're on zeolites, fulvic acid, glutathione, or anything along those lines, that's essentially provoking. Those are essentially chelators, what we call them, where they're taking, binding, and removing out the product.
Right. If someone has food sensitivities to ginger and cinnamon, would it be safe to use them to fight a biofilm, or should they choose something else they're not reactive to?
Depends on the food how high they are on the food sensitivity. And so typically if you did a food sensitivity and they're in the red and they're like very high sensitive, I would take them out. If they're in like a low yellow, like 15 or below, you can rotate. I don't typically put people on the same antifungal or oil or anything like every single day. So that's like tinctures sometimes are even too strong for people with mold. Sometimes you have to like layer in. You could do pau de arco, you could do cinnamon, you could do thyme, you can like put them in and kind of pulsate them too. You could do like a week on strong and then wait a week or so and then do a pulsate and add it back in and then stop again. So it really just depends on that person. So like I have kids sometimes that are sensitive to black walnut. So there's obviously specific antifungals, antimicrobials that I can't use because they're very sensitive to black walnut and I can't use it every day.
All right. I'm just going to mention that the slides, recordings, and giveaways will all be sent tomorrow to all webinar registrants. I know that's a common theme question. Here's another question. Does a low nickel diet help lower H. pylori virulence, or is a formal detox necessary for that?
Actually, that's a great question. They did a study and they had almost like an 83% reversal of H. pylori when people did they were doing 2 antibiotics and 1 other supplement plus a low nickel diet, reversed and got rid of H. pylori almost about 83% versus only using antibiotics was only 43%. So yeah, actually a low nickel diet, those are things like your pear, your figs, like some of your fruits and vegetables, like, and it worked. So that's actually a really great question.
Someone else wants to know how you learned about all of this. They've been for over 10 years and you've done so many advanced trainings, but your knowledge is like next level, Greer.
Yeah, you know what, when it's kind of close to you and you hit home. So my son is diagnosed with autism. And I first got into this about 5 years ago and it kind of catapulted me. So, I just kind of started going down those rabbit holes. I started with heavy metals and I just kind of learn, like every day I'm constantly learning something new. Every day I'm, and this world is so huge. I feel like I don't know everything and I feel like I'm not an expert. But I just love learning and I like I like just researching. I like reading research studies and, I think it's just really important to just take a topic and just kind of start understanding the basic components and, there's so many certification trainings out there and that's what I love, like I just finished my Lyme practitioner course because I was curious about it. I wanted to know how this fit in with everything else that I'm learning too. So never stop learning.
All right, next question. What about someone who can't get away from their water damaged building and has something like SIRS? Any recommendations for binders or someone living in a moldy environment to help them?
Yeah, so this is not uncommon. There are times where people just are not in the chance to move. They just financially or whatever can't move. So one, you need to identify where the mold is in the home. Okay, so try your best to find out where it is in the home to either have someone come remediate it or try to kind of close it off. You could definitely take binders, fulvic and humic acid, activated charcoal. The only problem with using binders consistently is you don't want to take them for so long because it will start actually depleting your nutrients. So you need to also make sure you're keeping up with the time with your vitamins, minerals, amino acids, things like that. I would get a very amazing air filtration system. You want a HEPA filter, you want a carbon filtered one that, particle size goes down to like 0.01, it's got to be able to pull that out of the air too. And I usually say leave it by your bed and then put one wherever the mold is in the home. Like try to do your best for that. Those would be like your biggest, things that would be the most helpful for you.
All right, 2 follow-up questions here. How long is long for binder use? Are you talking 3 months, 6 months, 6 years?
Yeah. So if you've done a test and you know what you need to bind, I say you do a protocol for anywhere between 3 to 4 to 5 months and retest. Because you want to make sure that what you're doing is effective and working. And again, all binders are not created equal. So you want to be able to see what you're actually chelating and binding and getting rid of, and then kind of assess. I usually say you'll stop for like a month, you'll test, and then let's see where your levels are and then see what else you could possibly need. You might need a few more months, but let's make sure before we continue. So usually I don't say anywhere longer than 4 to 5 months on binders, but you need to make sure you're taking your vitamins, minerals, amino acids. Do not take them 6 hours apart. Okay, so if you're going to take your binder, take your vitamins, minerals, amino acids at least 6 hours away from your binders.
Thank you for that. And then someone else wants to know, what's the best air filter? They have 5 filters and don't fully trust any of them.
I actually, and the name is, I want to say it's like Life Pro or something. I was just reading it and now it's like, it didn't stick to my head yet because I saw it quick. I mean, I have a couple different ones. I mean, I don't have mold in my house. So, I mean, I've checked, I'm a neurotic freak. I checked everything. I have EMF readers. I have everything. So, I do like the Air Doctor for just, I think that's a great one. I have Blue Air, which is also a nice one, but again, I don't have mold. But if you're in a place with molds, you can email me and I promise I will find you the name, because I want to say it's like Life Pro, but I don't think that's right. But you can email me and I'll definitely find you the name.
All right. So we've got a question about when you take binders, how many times a day you're taking binders. And if you're taking binders 4 times a day, how would you get that 6 hours apart with a supplement?
Yeah. So, I mean, it's a rule of thumb is 6 hours. You could do 4 hours. I just try to make it so it's at least like you have enough time to take your vitamins where you're not, you're not chasing it with a binder. You can't, you have to space it out enough. And don't have to take binders 3 to 4 times a day. I mean, that's usually maybe twice a day. And I usually try to stick the multivitamins, minerals in between. But yeah, it could be a little challenging, and that's why it could be tough sometimes. And you could still take them a few hours apart and you'll still have issues with some of your nutrients.
So another, someone suggested, is it the Blue Air?
Blue Air is one of them. I have a Blue Air by my bed, which I love. And it sounds like an airplane, which is great because I love noise at night. So for me, it's perfect. My husband hates it. And And I like that one. I mean, because you have to think about, like, they're not cheap. I mean, especially like a replacement filter can cost you hundreds of dollars. So, you know, financially, not everyone can do that as well. So, you know, I like the Blue Air. I like the Air Doctor. I mean, even the small stand up, the smaller Air Doctor does a pretty decent size room. And I have that one for my boys' rooms, and it's perfect. I love it.
All right. How can someone find your email address?
I could put it in the chat.
Thank you. All
I have
right.
it written down upstairs. I was just learning about like some of the different filters and stuff, and someone was like, "This is the best one for mold." I was like, "Oh, okay." I wrote it down, and then I did something else. I didn't stick in my head yet.
That's always how it goes, right? For those binder handouts that we're going to be sending, does that include research and evidence, links to the citations?
Oh yeah. So I spent hours researching each individual mold and each individual binder. Okay. So everything is research based. And if there was no research, it didn't go in. So you might see some possible discrepancies with other mold binders out there. But that was because I could not find a research study on anything, whether it be human, broiler chickens, or anything to actually prove that that particular binder could bind to that mold. So everything is evidence-based.
Thank you. I'm not seeing any new questions, so I'm going to just have some closing remarks here. Thank you, everyone, for your engagement and your business. Vibrant appreciates your support and the work that you are all doing to advance the functional medicine disease prevention and wellness model. Immediately following this webinar, you will receive a short 5-question survey. If you have time, please complete the survey so we may gain insight into how well we are meeting your needs and how we may improve the clinical lab education programs, products, and services we offer you. Thank you so much, everyone. Have a good night.